Hi everyone, my name is Hyojin Suh. I am one of the neurology pharmacists here at the West LA VA, and today I'll be going over anti-seizure medications as well as some of their side effects and some of their management tips and tricks. So the objectives of this talk are to understand common seizure symptoms and first aid steps, also review some of the medication indications, common side effects you might come across, and drug-drug interactions. And then lastly, we'll go over the pharmacist's role in epilepsy, as well as seizure treatment and medication management. So here are some of the common symptoms of seizures. They are classified into focal onset, generalized onset, or onset of unknown origin, and the symptoms can vary depending on those seizure types. The first one is a preceding aura. So an aura is a term that some people use to describe the kind of warning feelings they get before having a tonic-clonic seizure. They may describe their seizures or their auras as having an unusual smell or taste. Some people get like a metallic taste in their mouth, strange feeling like a wave going through their head, stiffness, numbness, or tingling. And those usually happen a couple of seconds or minutes prior to having a seizure event. Other common symptoms are muscle contractions or spasms, rigid or tense muscles, uncontrollable jerking, lip smacking. Some people get wringing of the hands. They can also get kind of lapses in their awareness or temporary confusion and difficulty speaking. So it's important for patients as well as caregivers to know the signs and symptoms of seizures so that you know when to prepare and how to respond to these events. For our caregivers and family, what should we do when a seizure occurs? First of all, you want to stay with the patient and remain calm. Try to glance at a clock or start a timer on your phone because it'll be important to know how long the seizure has been in case you need to call 911 for prolonged seizures. Next, try to keep the person safe while they're expecting or experiencing a seizure. Try to move any objects away that might injure them if possible. And if they're not awake or aware of their surroundings, if you're able to, try to turn them on their side. It's also important that you don't compromise their airway so that they don't choke or injure their head. If they're not lastly, don't try to restrain them and stay with them until they regain consciousness. For the majority of the seizures, it should end in a few minutes, but prolonged seizures or those lasting longer than 5 minutes should seek medical attention. Here are a couple of other scenarios when to call 911. So the CDC recommends to call 911 if you or someone you know has a seizure and experiences any of the following. Seizures lasting longer than 5 minutes. So we already discussed that. And that's because they can go into something called status epilepticus, which is a neurologic emergency that needs to be evaluated by a medical professional. Secondly, if the person has difficulty breathing or waking up after a seizure, if another seizure occurs soon after the first one, that's called a seizure cluster. Also, a person that is injured during water or injured during the seizure, or if the seizure occurs in water, if the seizure occurs for the first time, or if the patient is pregnant or sick, they're just at a higher risk of injury, so to call 911 after. Rescue medications are what we use to break the seizure, and they are a drug class called benzodiazepines. The kind of main points to consider in using these medications is how fast will they act, what formulations are available. So some of them are available for like rectal gel, others are nasal spray, and how easy it may be to administer to the patient while they're having a seizure. Other factors that are important are costs, possible side effects, and everyone's comfort level in using these medications. So make sure to talk to your doctor as well as your pharmacist in regards to the directions of these medications in case they need to be used in a high stress situation. People who need these fast-acting medications at specific times for breakthrough seizures and who are alert and able to swallow may use one of the pill forms. So that's lorazepam or diazepam. However, many people will not be able to swallow during their seizures, which is why we need an important or a formulation that's different. Diastat, which is the rectal gel of diazepam, used to be the only FDA-approved medication available on the market for out-of-the-hospital rescue medication. However, currently we also have nasal spray of diazepam, as well as the nasal spray of midazolam that is recently FDA-approved. Clonazepam, it comes in an oral dissolving tablet, but you do have to attempt to place it in the patient's mouth, and it technically is not FDA approved for this indication. And then lastly, we have buccal solution of midazolam. So there are different options for treatment in order to decrease seizure frequency. There are surgical options, dietary methods, and medications. The anti-seizure drugs are the mainstay for medication treatment. And basically, the main goals of therapy are to decrease the number of seizures or stop them completely. For some patients, this may mean decreasing daily seizures to once weekly. For some, taking medications may stop the seizure altogether. You also want to avoid or minimize harmful side effects, and we also aim to decrease the costs of medications as much as possible. There are over 25 anti-seizure medications available, and how we choose them depends on the type of seizure the patient has, as well as the patient characteristics. So things like age, gender, especially for women of childbearing age, or if they plan to get pregnant, comorbidities, side effects experienced or anticipated, and then also patient preference. For example, someone who is not able to take their medications in the middle of their day because of maybe their job or nature of their work might have to forego a medication that you have to take 3 or 2 times a day. They may opt to take medications that you may only want to take once a day. For the purposes of our talk today, I'll be focusing on the most common medications that we see for focal onset epilepsy, since that's the majority of the seizure types that we see for our veteran population. So here are some of the medications I'll go over. They are marked in the asterisk in red, and it's basically a graph of all of the anti-seizure medications and their mechanism of action. So as you can see, we have different medications that act on different parts. For all of the ASMs we'll talk about today, I'll go over these important points. I'll mention if they have other indications or other uses, because if we can treat multiple things with one drug, it'd be like killing 2 birds with 1 stone. Then I'll also go over common side effects as well as the potential serious side effects. And just a caveat that most of the anti-seizure medications can cause somnolence or sleepiness, a potential for rash. Most of them may cause liver dysfunction, as well as balance and gait issues, and GI issues such as nausea, vomiting, as well as headaches. And I'll also be going over major drug-drug interactions of each medication. So the first one we have is called Phenytoin. The brand name is Dilantin. It's actually one of the oldest drugs we have for seizures that's been used since 1938. And some of the potential serious side effects of this medication is rash. So up to 10% of people may get rash, as well as gingival hypertrophy, which is a abnormal enlarging of the gums. It can also lead to liver issues as well as heart rate abnormalities and blood count abnormalities. So you may hear things like low platelet count, but if you are taking this medication, your doctor will be monitoring for this. And this is a medication that is has a lot of drug-drug interactions since it is an inducer of metabolism. So what that means is that it's basically going to encourage or promote metabolism and breakdown of other medications. And some of those other medications are HIV medications, blood thinners, antifungals, and other anti-seizure medications like Lamotrigine or Perampanel, as well as opioid pain medication. So if you're on any of those, it could interact with phenytoin, and you do want to monitor blood levels. Luckily, we can draw the level of the medication that's in your blood in order to control the efficacy of it. Next is a medication that is very commonly used for seizures called Levetiracetam or Keppra. It was actually approved in 1999, and it can also be used for migraine prophylaxis. Some of the common side effects you might experience are mood changes, such as aggression and mood lability, as well as somnolence. So especially when beginning this medication, up to 40% of patients may experience somnolence, and it can also be dose dependent, meaning the higher the dose, the more somnolence you might feel. It can also lead to changes in bone density as well as headaches, and like others, it can cause rash as well as blood count abnormalities. This medication is actually one that doesn't have any major drug-drug interactions. However, if you do take medications that have the same side effects of these, such as the drowsiness, it can increase the side effects of those medications. Next is Topiramate. It is used for migraine prophylaxis as well as weight loss on top of treating seizures. And some of the common side effects are neurocognitive effects, so things like confusion, impaired thinking, or impaired memory can occur with this medication. It can also lead to abnormal blood levels of serum bicarbonate, loss of appetite and weight loss, and paresthesia or tingling sensation, and drowsiness and fatigue. And the potential serious side effects are listed here. The blood level abnormalities can also be monitored by your provider. And it is an inhibitor and can be an inducer at high dosages. So patients that are on birth control, it can actually interact with your birth control. So make sure to monitor for that or use backup method. Next is valproic acid, and these medications are also used for mood disorders as well as migraine prophylaxis. We can also measure the blood levels of these, and here are some of the common side effects. So hair loss can be common as well as weight increase. There's also a lot of GI side effects such as nausea and diarrhea, and these are more common in the immediate release formulations, which are not as commonly used in the outpatient setting. So if you are using the ER version of it, there will be less GI side effects, and also potential for somnolence as well as tremor that is reversible if you stop the medication. It can also cause low platelet count in your blood. So patients that are undergoing major surgery might be told to discontinue this medication for usually a couple of weeks to a couple of months prior to surgery. It can also lead to ototoxicity, which can lead to deafness or ringing of the ears. And there is a low risk, however, a serious risk of getting pancreatitis. And this pancreatitis can actually lead to a hemorrhagic pancreatitis. And if this ever occurs to you, we definitely do not want to retrial this medication again. It is an inhibitor of other medications, so it can increase the clearance of, it can decrease the metabolism of medications. So one important one is if you are on a medication called lamotrigine, valproic acid can actually increase the levels of lamotrigine in your body. So you want to make sure to let your provider or your pharmacist know anytime you're on these two medications concomitantly. And it is not for women of childbearing potential because you can't take it when you get pregnant. And then lamotrigine is a medication that can also be used for mood disorders, so things like bipolar disease or bipolar disorder. We can also measure the blood levels of it. And one unique and serious side effect of this medication is vision changes. And it can also have a pretty serious consequence of rash. So you may have heard of the word called Stevens-Johnson syndrome or toxic epidermal necrolysis, and this has a potential for that, especially when it is started and titrated very quickly. So anytime you start this medication, usually the dose is slowly increased every 2 weeks in order to decrease the risk for this. This rash can also happen a couple of months later, so you want to make sure to monitor for any types of rash that occur when you're on this medication. Some of the major drug interactions with this medication are other anti-epileptics. So as previously mentioned, valproic acid can increase the levels of lamotrigine. Other medications, such as the ones that are inducers, so the ones that we talked about previously, such as Phenytoin, and the other ones we'll talk about later, Carbamazepine, Oxcarbazepine, and phenobarbital, those can actually decrease your levels of lamotrigine. And birth control can actually decrease the effectiveness of lamotrigine. So any of those medications, if you're on it together, should be mentioned to your provider. Right, so carbamazepine is the next one, or it's also called Tegretol. It can be used for pain. One common one is trigeminal neuralgia, and it can also be stabilizing for mood disorders. Can also measure blood levels for these medications, and some of the common side effects are tinnitus or ringing of the ears, GI side effects, ataxia or abnormal movements, phonophobia, and potential for rash. It can also lead to heart rate abnormalities, decrease in the sodium or salt level in your blood, so hyponatremia, blood count abnormalities, as well as pancreatitis. And because it is an inducer, it can increase the metabolism of other medications, thus decreasing the concentration of drugs. So those medications that are affected, some of the common ones are antiretrovirals or HIV medications, blood thinners like apixaban, as well as antifungal medications like voriconazole and fluconazole. It can also decrease effectiveness of birth control, as well as other anti-seizure medications like phenytoin, lamotrigine, and perampanel. And you want to avoid grapefruit juice with this medication because it can actually increase the levels of carbamazepine. We also want to use it with caution in our older population and patients of Asian descent. So if you are of Asian descent, you want to make sure to check your genes to see if you have a certain gene that can increase your risk of having a rash before starting this medication. Next is like a cousin drug of carbamazepine. It's called Oxcarbazepine or Trileptal. It's an analog of carbamazepine, but it doesn't have the auto-induction as the previous medication. So the side effect profile is pretty similar. However, it does have a higher incidence of decreasing your sodium levels. And the major drug interactions is that it is an inducer as well as an inhibitor, so it does decrease concentrations of many medications, similar to carbamazepine. But like I previously mentioned, no autoinduction properties. Next is Lacosamide Vimpat. We can also measure the blood levels, although it is not as clinically relevant. And it doesn't have as big of a side effect profile as the other anti-epileptics that were mentioned. So some of the more common ones are dizziness, headache, and nausea. And the potential serious side effect is heart rate abnormalities. So if you already have other heart conditions, they might do an EKG at baseline or prior to you starting this medication. No major drug interactions. However, this medication is considered a controlled substance, class 5. So that could be have an extra step in getting these medications. So if you ever run out of refills, make sure to get them filled earlier than later. Next is clobazam or Onfi. Also, we can measure the blood levels, but also not always clinically useful. Some of the common side effects are changes in behavior, like some patients may experience increase in aggressive behavior, somnolence, as well as drooling. Some of the major side effects, or sorry, drug interactions, it can actually increase sedation of other sedating medications, such as pain medications, mirtazapine, or benzodiazepines. And it can act as a inducer, although it is not as significant as other drugs. It can increase or it can decrease the side effect of some blood pressure medications as well as birth control. So to be aware of that. And this is also a controlled medication as well. Last medication I'm going to mention is perampanel or Fycompa. Some of the more pertinent common side effects is irritability or mood changes. So you might notice changes in that after starting this medication. If it becomes severe, you might want to discontinue it. Or if you have any other psychiatric diagnosis, you might want to stay away from starting this medication at all. And the major drug-drug interaction is that it can interact with other medications that induce the metabolism of this medication. So carbamazepine, oxcarbazepine, phenytoin, and topiramate can decrease the levels of perampanel. And like clobazam, it can also increase side effect of other sedate medications. And this is a controlled substance, class 3 medication. Next, I want to talk about medications that can lower the seizure threshold. So these medications can actually increase your risk of having seizures. Thus, if you don't absolutely have to be on these medications, you might want to not start them or switch them to other agents if you are able to switch them. So tricyclic antidepressants, things like amitriptyline or nortriptyline. Also medication used for depression called bupropion or Wellbutrin. This medication can also be used for smoking cessation. Tramadol is a pain medication. Penims are IV beta-lactam antibiotics that may be used if you are hospitalized. Same with quinolones, those are antibiotics. They're available as oral or IV medications, as well as opioids at high doses. So what's important to know is that anytime you are started on a new medication, whether that's inpatient or outpatient, it's important for your doctors and pharmacists to know that you have a condition called epilepsy and what medications you are on in case there are any interacting medications. Next, I want to quickly talk about the difference between brand and generic medication. So branded drugs are basically the original version of the drug that's produced by a pharmaceutical company. For a period of time when the drug is on patent, when it first comes out, it means that only the company that developed the drug can produce this branded form. However, once that patent is over, different pharmaceutical companies can make the generic version of the medication that contains the active ingredient. They are generally have so they're exactly the same in the active ingredient, but they may differ in the inactive ingredients that are included. So things like fillers or coloring, binding agents can vary from one version to the other. And in some cases, it is thought that some of these ingredients can affect how the drug is absorbed in the body. But theoretically, they should be bioequivalent to the branded original. There are, however, anecdotal reports of unsafe substitution, so definitely talk to your neurologist prior to switching brands. For us at our VA, we have a contract with certain companies so that we have the same manufacturer for all of our medications for seizures. Adherence to anti-seizure therapy is very important. Approximately a third to one half of the patients may be non-adherent at some point in their lives. The risk is especially higher if they are of adolescent age. If you do have trouble adhering to your medications or taking medications multiple times a day, there are certain medications that are dosed once a day or have a longer action of duration. So we want to discuss potentially starting those instead. And adverse effects are also a common cause of non-adherence. So you definitely want to let your doctor know if you are experiencing any side effects during your visit. Periodically, your doctor may also get blood levels of medications that have blood levels available in order to help assess adherence, but also absorption. And then patient education is an important strategy to promote adherence. So anytime you feel like you need help with remembering to take your medications, try to talk to your doctor or your local pharmacist who can help devise a plan as well as give you tips and tricks to increase remembering to take your medications. Pharmacists in epilepsy, there are pharmacists specializing in neurological disease states, such as epilepsy, and they may be available at your hospital or your VA hospital. Pharmacists' role are to help with titration or tapering of medications. So many of these medications you need to slowly increase the dose and also slowly decrease the dose. You never want to stop taking medications abruptly unless you are experiencing very serious side effects and you talk to your provider. Pharmacists can also help manage your side effects as well as recognizing drug interactions with other medications, monitoring of drug levels, and adherence as well as decreasing costs. Lastly, here are a list of some tips and tricks for anti-seizure medications as well as any medications. So always know potential side effects of medications in case you experience them. Remember that some side effects can be delayed. So sometimes side effects may appear months after you start the medication. So it's important just to be able to recognize it. Store your medications properly, so they should be stored in a cool, dry place, preferably not in your bathroom. If you have a medicine cabinet inside your bathroom, if you take showers, it will get moist in there, which can compromise the integrity of the medication. So make sure to store it in a dry place. Some of my patients I've heard like to store their medications in the car because they remember that's when to take them. But in the heat, it can actually damage the medication. So I would advise everyone to keep them in a temperature controlled space. Also try to space anti-seizure medications equally apart. So if they are dosed twice a day, you want to make sure to space them out as close to 12 hours as possible, just so there's no dips in the level of your medications, which can increase your risk of having a breakthrough seizure. Also, try to take them at the same time every day. Some patients I've heard may have a breakthrough seizure if they miss their medications by a couple of hours. So try to set an alarm on your phone if you are able to. And if you miss a dose, do not double up on your dose if it is close to the next dose time. So if you take your dose, let's say at 6 a.m. and 6 p.m. and you forgot your 6 a.m. medication and you remembered around 4 p.m. Don't take that missed medication because you're close to your 6 p.m. time dose anyway, and just monitor for any signs or symptoms of breakthrough seizures. Always carry a list of your medications with you at all times. Try to keep it up to date if there are changes in your dose, and make sure to bring this with you to any doctor's appointments if possible. For patients that have a lot of medications, something called a medication calendar can be helpful. So that is a list of your medications and when to take them and the time to take them throughout the day. If you ever see pharmacists in clinic, they may be able to help you create one of these calendars for you to keep with you at all times. Never change or stop taking your medications without informing your doctor. You never want to abruptly take or stop taking your medications unless you have a very serious side effect in which you would need to contact your doctor. You can also use a medication organizer or a pill box to help you remember. There are ones with 3 or 4 different time slots throughout the day if you have multiple doses that you need to take throughout the day. And something that could be helpful is a seizure diary. So this can consist of when you're having a seizure, the time, the surrounding environments around it, what you ate for that day, to try to figure out if there's any type of triggers that are associated with your seizures. Always remember to refill your medications before you run out. And for those patients that are living in areas such as SoCal or Southern California where earthquakes are a potential, make sure you have a good supply of your medications in case of any emergencies. And always be mindful of how many refills you have remaining, especially if those medications are controlled. A lot of the pharmacies that dispense seizure medications, sometimes if you run out of refills, they can actually give you just like a 3 to 5 day supply of your seizure medications, even if you don't have refills, since these are very important medications. But it is definitely more difficult with controlled medications. So things like perampanel and clobazam that we previously talked about. So that is the end of my slides, and I'll take any questions at this time.
Thank you, Jen, for the wonderful presentation. Doesn't look like we have any questions so far. Thank you for your time. That's great.